Thank you for watching this video. My name is Dr. Paul Chang. I work at Toronto Centre for Advanced Reproductive Technology Fertility Partners in Toronto, Ontario, Canada. My talk is entitled Supplements to Improve Female Fertility. I want to take this opportunity to review the evidence of how nutritional supplements affect female fertility. So to start off, I like to show you my first slide, which depicts the oocyte, the mitochondria, which is the engine, the energy source, ATP, and then the fuel source, which is our food intake. Just as we can't run our sports car without good fuel, the same thing applies to how we should think about the human female reproductive system. Our diet has drastically changed over the times. So initially, our diet is more Paleolithic type, that is high in fiber, potassium, complex carbohydrates, and proteins. It is low in sodium, refined sugars, and energy density. The plant-to-animal energy ratio was 1:1, with the net acid load being more alkaline. With the emergence of agriculture 5,000 to 7,000 years ago, then the coming of the Industrial Revolution, and then finally 30 years ago, our modern westernized diet come to being. Our diet is now low in fiber, high in sodium, high in simple sugars, fructose, and also high in fat intake. The micronutrient content has declined dramatically. This new modern westernized diet is dangerous. The high fructose and high omega-6 content instead of low omega-3 intake causes insulin resistance and metabolic syndrome. So this means high triglyceride levels, high LDL, low HDL. This results in heart disease, insulin resistance, liver disease, etc. The link between adiposity, insulin sensitivity, and dementia has also been demonstrated. For the longest time, Western doctors, in particularly the infertility specialists, we believe in the irreversible exhaustion of the ovarian reserve, as well as the irreversible decline in oocyte quality. So with regards to this decline in ovarian reserve, we believe that there is an absence of replicative germ cells in the postnatal ovarian tissue. But since 2004, we have now discovered the existence of precursor oogonial stem cells in mice, followed by the existence of precursor oogonial stem cells in reproductive age women. With regards to oocyte quality, we all understand that dietary supplements may help in making them better quality, and that's what I will be reviewing shortly. But also that the type of fertility drugs that we use during IVF stimulation has an impact on this as well. And then most recently, there is a new technology called Augment, which has allowed us to extract younger, healthier mitochondria from these precursor oogonial stem cells, and then to introduce that back into older oocytes. And then through this technology, there is hope that we'll be able to reverse this decline in oocyte quality. Now I'm going to show you and review evidence on how nutritional supplements may impact on female fertility. Let's begin by talking about coenzyme Q10. It is an oil-soluble vitamin-like substance that is present in most cells, primarily in the mitochondria. It is an important component of the electron transport chain, and it is needed for aerobic cellular respiration to generate energy. It is the most potent known antioxidant, and organs with the highest energy requirements have the highest coenzyme Q10 concentrations. When coenzyme Q10 levels decline when we start to age, and roughly that decline occurs between our ages of late 20s to early 30s, This results in a decrease in antioxidant capacity in our body, then that results in increased reactive oxygen species damage to our cellular components. This further reduces the coenzyme Q10 synthesis pathway, then it further reduces the amount of coenzyme Q10 that's in our body. Furthermore, when there's a decline in coenzyme Q10, the ATP production, or our energy source, declines. This results in a compensatory increase in the number of mitochondria in the body, and they start to work harder. That then further increases the reactive oxygen species production, and then the whole pathway continues downwards like a vicious circle. The hypothesis is that by adding coenzyme Q10 back into our body through supplementation, this will enhance oocyte mitochondrial energy production, increases its antioxidant activity, and ultimately improve the embryo development. This is a slide depicting the study design of a mouse study that was done at TCAR a few years ago. So mice, 30 years of age, 20 of them were divided into two groups. Half of them received coenzyme Q10, and the other just were given control diets. Then the other group were 10 young mice of 10 weeks of age, and there were 6 of them. These animals were grown to 52 weeks. They were superovulated, and their eggs were collected. Then we looked at the nuclear spindle and chromosome imaging studies. We checked the mitochondrial functions and gene expressions, as well as we took the follicle counts from ovarian sections. We discovered that the number of oocyte retrieved from the older mice in the coenzyme Q10 group were much higher than the control old age mice. When we look at the mitochondrial function genes, we can see that our control young mice and our coenzyme Q10 older mice were expressing same types of genes versus the controlled older mice that their gene expression in mitochondrial function were downregulated. When we look at the reactive oxygen species, you can see in this slide that the younger and the older coenzyme Q10 mice have expressions as well as images that were very similar. When we look at the nuclear spindle imaging, again, you can see that in the young mice, there's a nice barrel shape with alignment of the chromosomes in the middle, and you see the same type of image with the older mice taking coenzyme Q10 versus the older mice that were on regular diet. You could barely make out the spindle structure, and the chromosomes were malaligned. So in summary, coenzyme Q10 supplementation on old mice improves the ovarian response to stimulation, increases the cumulative cell number, improves oocyte mitochondrial function, restores normal nuclear spindles, and it has great potential to delay ovarian follicle loss due to aging. So let's move on to a study involving humans. So this was done by Rafi and was published in 2014 in Reproductive Biology Online. It's a prospective randomized controlled trial involving 110 patients who have PCOS and were resistant to clomiphene citrate therapy. These patients were then randomized into getting more clomiphene citrate or clomiphene citrate with the addition of coenzyme Q10. These patients then undergo fertility treatments, ovulation induction, and this is what they reported. That the clinical pregnancy rate between the two groups were significantly different. So the group that received coenzyme Q10 with clomiphene citrate, the clinical pregnancy per patient was 37.3% versus just 6% in the clomiphene citrate therapy group. And also of note is the ovulation rate per cycle is also dramatically increased. So in the clomiphene citrate plus coenzyme Q10 group, that's 66% ovulation rate versus just 15.5% in the clomiphene citrate alone group. Now let's move on to fats. As I mentioned earlier, that our modern diet, there's a lot more saturated fat in what we take in daily, as well as we're ingesting a lot more omega-6 fatty acids. Conversely, we're taking much lower amounts of omega-3 fatty acids. And these two omega acids are physiologically and metabolically distinct, and they have opposing properties. In our common cooking oils, corn oil, sunflower oil, safflower oil, and soybean oil are high in omega-6. Olive oil, canola oil, chia oil, and perilla oils are high in omega-3. Omega-3 is an essential fatty acid and is polyunsaturated. It is found in mitochondrial membranes. There are three types. ALA is found in plant oils. EPA and DHA are commonly found in marine oils. Omega-3s have anti-inflammatory effects. The long-chain omega-3 fatty acids are critical for fetal brain development. In 2012, NERA published this paper on the importance of omega-3s and how they may improve egg quality. This study was done in mice, and there were two components to this study, a long-term breeding trial and a shorter acute dietary supplement trial. They fed these mice three types of diet, one that's high in omega-3, one that's high in omega-6, and one that's pretty much deficient in the omega fatty acids. In the long-term breeding trials, they aged these mice up to 10 months of age, and what they discover is that those on omega-3 rich diets were able to produce litters. They were smaller than the younger cohorts on the same diet. However, the offspring born to these dams at advanced age were quite high at 89%. Conversely, none of the advanced age animals on omega-6 rich diet had any viable litters. So their conclusion was that there's detrimental effects of high omega-6 fatty acids to female reproductive success, and that omega-3 can extend the reproductive success at time of reproductive decline. With regards to short-term oocyte quality studies, they fed these animals 12 weeks worth of these three types of diet, again, high in omega-3, one that's high in omega-6, and one that's deficient in essential fatty acids. And what they've noticed is that when they look at the mitochondrial analysis, that in the animals fed DHA, all of them were showing normal expressions of genes, versus only 1 out of 3 on the omega-6 diet and then none on the deficient diet. In terms of DNA spindle studies, 4 out of the 5 animals on the omega-3 diet showed normal configurations versus 0 out of 5 in the omega-6 rich diet and only 2 out of 3 in the deficient diet. So their conclusion was that omega-3 again is beneficial to oocyte quality versus omega-6 is detrimental. Let's look at another study that focuses on how omega-3's intake may impact on human reproductive success. And this study involves 235 women undergoing IVF ICSI cycles. A questionnaire was administered to understand what their intake was like 4 weeks prior to their IVF cycle, focusing specifically on the omega-3 intakes, the omega-6 intakes. And what they've discovered is those women who take high ALA show higher baseline estradiol levels during their stimulation cycle. Those that ingested high levels of EPA and DHA had actually reduced level of estradiol level, and they have also reduced number of follicles. Those that ingested higher ALA and DHA had improved embryo morphology. So the conclusion was that higher omega-6 to omega-3 ratio is positively associated with improvement in number of follicles in these study women. Now let's move on to the impact of vitamin D. Vitamin D is a prohormone that is fat soluble. It is important in estrogen biosynthesis in the human body. It's involved in cellular immunity as well as autoimmunity. In higher latitude countries, women are prone to deficiency, especially in winter. And the level of vitamin D in the body is inversely related to one's BMI. Vitamin D receptors are found in ovarian and uterine tissue. In a study done by Garbidian, and that's published in 2013, they looked at 173 women undergoing fertility treatment, and they measure their serum vitamin D levels. They deemed 75 nanomole per liter or higher to be sufficient, and less than that to be insufficient. And they were looking at the measuring the clinical pregnancy rate. And what they discovered was a significant difference between the two groups. So those patients who were found to be vitamin D deficient, the pregnancy rate was only 37.9%, versus those who had sufficient vitamin D levels. Their clinical pregnancy rate per embryo transfer was 54.7%. Now let's move on to vitamin C and vitamin E. So in this study done by Reuter and published recently in Fertility and Sterility, they looked at 503 patients who were part of a different trial called the Fast Track and Standardized Treatment Trial. Again, this is a questionnaire study, and what they discovered is that intake of vitamin C from dietary supplements was associated with shorter time to pregnancy among women who were less than 25 kilograms per meter squared, so the non-obese women, and those who were younger than age 35. And what they also found was that the intake of vitamin E from dietary supplements among women who were older than 35 was associated with shorter time to pregnancy. Now let's talk about zinc. Zinc deficiency causes abnormal embryos and fetal developments. Zinc is an important factor for completion of meiosis and egg activation in vitro and for follicle rupture. Its deficiency leads to methylation defects of DNA in oocytes. Zinc deficiency is common in many parts of the world, and it's especially more prone in women with gastrointestinal diseases such as Crohn's disease, ulcerative colitis, and liver diseases. Those on vegetarian diets are also at risk. This study by Tien looked at how zinc affects the oocyte quality in animals. And the study found that acute dietary zinc deficiency before ovulation decreases oocyte quality and developmental potential. So in terms of fertilization rate, it is much lower in the dark bars. These are the zinc deficient diet animals, as well as the blastocyst formation is also lower compared to the controls. Iodine is another important micronutrient that we should consider. We understand that if a pregnant woman's diet do not have adequate iodine, the fetus cannot produce enough thyroxine, and as a result, fetal growth is retarded. Hypothyroid fetuses often perish in the womb, and many infants die within a week of birth. Iodine deficiency is one of the primary causes of hypothyroid states in reproductive women. While iodine is added back in table salt, many women do not use enough salt to prevent a deficiency. Furthermore, with the recent fad of using more natural sources as well as sea salts, those type of salts do not contain iodine. Women planning a pregnancy, including those with thyroid disease, should take daily iodine supplements of 150 micrograms. This slide shows is taken from a Canadian census showing that iodine deficiency is actually quite prevalent especially in a reproductive age people over the age of 30. Having said all that, research in this area is very limited because there are many, many confounders to take into consideration. We have very complex diets, beliefs, and due to racial and geographic differences, these are all realities. And many reproductive age women take supplements anyways, so that also complicates any research that may be conducted by health professionals. The ethics question is also important because it is unethical to restrict subjects from taking potentially helpful supplements in order to do a randomized control study. Research funding in this area is limited as a result of low interest from pharmaceutical companies, as they cannot put patents on vitamins. And lastly, the actual impact and the size of this impact of nutritional supplementation to fertility is likely not very big. So let's talk about how we can use these information and apply them in a useful way. So published studies so far have provided evidence that micronutrients affect fertility, embryogenesis, and placentation, and that the prophylactic use of micronutrients may be useful in preventing adverse pregnancy outcomes. In 2012, AgriWorld conducted a study looking into how a multivitamin in the form of what is called MMN. This includes vitamin B, antioxidants, vitamin E, vitamin C, iron, zinc, selenium, iodine, vitamin E, and L-arginine. So 28 women were randomized to folic acid alone versus 30 to taking this MMN supplement. And these recruited women had anovulatory or unexplained infertility as their diagnosis. Ovulation induction was achieved using either clomiphene citrate or Menopur. The cumulative clinical pregnancy rate in women on the supplement was 66.7% compared to those on folic acid alone of 39.3%. And this is statistically significant. The ongoing pregnancy rate in women on MMN supplement was 60% versus those on folic acid, who only achieved 25% ongoing pregnancy rates. More simply, we may consider adopting a Mediterranean diet, as this has become more and more popular in the reproductive field. So what is a Mediterranean diet? It is based on fruits, vegetables, whole grains, seeds, herbs, spices. The involvement of ingestion of healthy oils such as olive oil, sunflower oil, taking in fish at least twice per week, such as salmon, sardines, and tunas. Seeds, including almonds, cashews, and pistachios, are part of this diet. Moderate portions of cheese and yogurt daily, moderate portion of poultry and eggs every 2 days or weekly. Red meat should be limited, and lots of water instead of red wine. Vukovic in 2010 published a study looking at women who practice a diet or who follows a diet that is more healthy conscious. One type is the low processed diet, which mainly constitutes fruits, vegetables, fish, whole grains, with low intake of snacks, meat, and mayonnaise. The other group follows the more strict Mediterranean diet. So again, mainly vegetable oils, fish oils, vegetables, and legumes, and with low intake of snacks. The results that she found with these Dutch couples with high adherence to Mediterranean diet have 40% increased probability of pregnancy. And their conclusion was a higher vegetable oil from omega-3s and the higher resultant vitamin B6 levels from this type of diet may be associated with improved pregnancy in IVF and ICSI patients. Chavarro presented a poster in 2012 that found similar results. And their conclusion was that women who ate the most unsaturated fats found in olive oil-based Mediterranean diets have almost 3 times the chance of giving birth after IVF treatments. Furthermore, those who take lots of saturated fat, they had fewer mature metaphase 2 oocytes. So in summary, optimizing the female preconception diet through the addition of supplements is a low-cost intervention who can enhance fertility, especially those who are undergoing advanced reproductive technology. More research is needed to clarify and quantify the positive impacts of nutritional supplements for different causes of female infertility. I thank you for listening to my talk today.